had, 4 days now, this is day 4 of immersing ourselves in VR in healthcare. So yeah, Tuesday and Wednesday, all the great work that Bob's been doing with the IVRHA. Been learning lots, and just I think both of us have been absolutely fangirling the Veterans Association as well, and just very much in awe of all the cool stuff that's going on.
And Joan, we fangirl Joan.
Oh, lot, just everyone.
Shout out to Joan.
Yeah, woo! Sorry, I think we're like at the end of like day 2 of this as well, and I'm hoping that everyone else is also in a state of like, we've all lost it now and just gonna...
We've had some caffeine. We're gonna try and keep you awake. It's like the graveyard slot. We appreciate it, so...
Yeah. So, hello. So we'll start with a bit of introductions from ourselves, a bit of context setting, but we're just going to have a bit of a loose chat about some of the things that have been going on in the UK with our sort of United XR healthcare strategy, and really excited to also have a chat with you guys towards the end about your opinions about what's happening on the world of XR and healthcare. So, Sam, what's your name? Where'd you come from?
For those from the UK, what's about blind date reference? That might be lost on everybody. But I'm Sam Ingram.
Well, I can in-joke.
I'm the Operations Director of the Innovation and Intelligent Automation team at the Royal Free London NHS Foundation Trust. And that is a long mouthful of a title. But basically what that means is I run the operations and strategy function for our innovation team, which is a 2-year-old innovation consultancy within an NHS trust in the UK, which is a really unusual thing. So it's really rare to have a consultancy within the NHS. We usually like to pay a lot of money to the big 4 external management consultancies. So setting one up within a trust is quite unique. And setting up an innovation consultancy and automation one within a trust is also quite unique. So that's what I do. And I also have the privilege of being the SRO for our XR programme of work at the trust.
What's
hence
an
being
SRO?
Here. Oh yeah, we love an acronym. Sorry about that. Senior Responsible Officer, Owner? Person who oversees stuff, I guess. But I have the privilege of working with a large team of people within our programme, so we'll talk more about that in a second.
Great.
That's me.
Cool. And hi, my name is Sarah Tico. I wear quite a few hats in the world of XR and healthcare. And so my interest initially came from my own lived experience of mental health. So I actually started my career working in contemporary art and film after studying anthropology. It's been a bit of a journey, but it was my experience of navigating the healthcare system in the UK and really trying to find ways to articulate my lived experience, and just kind of got met with this sort of world of standardized assessments and really like medicalizing my experience, that I became really interested in the role of storytelling and how we can empower patients to be heard. And so it was hearing someone talking about VR that I became really fascinated in it as a tool to be able to represent lived experience. And then it was through that journey of being like, oh, well, what cool experiences are there out there, that I discovered how it was also being used therapeutically, and just thought that was mad, that you could have this sort of interactive game thing that I just thought was for like boys in their bedrooms to like shoot zombies, that you could actually, you know, reduce pain, help people like learn mindfulness skills, how you could like train surgeons. And so eventually started to develop my own experience, my own company called Hatsumi. And it was coming back to the UK after working abroad for some time that I was like, wow, we have the National Health Service. We have this system that enables healthcare to be available to everybody, that I became really interested in, like, well, how do you bring VR into the NHS as well? And started speaking to other founders and doctors and just saying, like, how does it work? And they were like, well, it's very fragmented and it's quite hard to do. And so I met my other colleagues, my other co-founders, the XR Health Alliance, Ross O'Brien, who's part of the NHS and used VR at Grenfell Tower to really support the victims of this fire that happened in 2017, to support patients to talk about their lived experience and using VR to get them in referrals into the NHS as well. So a few years back then, we ended up having a conversation with the NHS of like, how do you adopt VR at scale? And they were like, well, we need to see the evidence. We need to understand what are the core applications of VR in healthcare, and what are the health economics of this? Like, how can it save patients' lives? How can it save clinicians' time? How can it save money? And so we worked with a range of stakeholders to create this report, very excitingly named The Growing Value of XR in Healthcare in the United Kingdom. And we brought together stakeholders from the National Health Service, Health Education England, other organisations, and we got as many people to work with us to co-write this report to start to petition the NHS to start to invest in this at scale. And we'd already seen loads of other amazing organisations doing great work in this space. Bob and IVRA have been really petitioning, bringing people together for a long time. But I think we really saw the unique opportunities that could be done in the UK, and thinking about opportunities for this more joined up thinking, but also how can we bring this further afield and think about how we can connect to the wider XR health community globally as well. And so here we are. And a few years later, as of 2 months ago, then UK government have now created a £20 million fund to support the adoption of XR in healthcare, particularly in bringing together the creative industries and gaming with healthcare to fund new projects, as well as think about new opportunities for procurement, standardisation and distribution. Sounds like it's all really easy and happening immediately, but there's a lot of working out and scrambling to do as well. But as part of the recommendations that we did in this report, one of the things that we really said is like we need XR centres of excellence. We need places that are really adopting this and embedding it across the hospital. And that's where we first met Sam nearly a year ago. So we at the XR Health Alliance have been working with the Royal Free Hospital to actually start to create early blueprints, think about what best practice is, and learning from other people that have been doing this for longer than we have as well. So we thought today was a nice opportunity to talk about this like work in progress that we've already started doing together, and explore that for the next bit of time. So Sam, from your perspective, because you're really new to VR, right? This has only been like a year. Like, what has been your journey into discovering VR and thinking about how it could improve the ways that your team are delivering healthcare?
Yeah, I'm a rookie. I'm a complete rookie. So I was new to innovation. My background is operations, strategy, and transformation improvement. But innovation in the NHS is an interesting term. It's kind of, some people look at the NHS and go, the NHS, really? Innovative? Come on. Because there's lots of bureaucracy, there's lots of red tape, it's, lots of paper-based processes. A lot of trusts still don't have an EPR even. So you think, how on earth can you innovate in that kind of system? But actually, I believe the NHS is a naturally innovative system. If you look at our track record in terms of research and development, there are some fantastic clinicians and others out there doing great things. So actually, I think it's really ripe for innovation and using innovative technology. So I joined the innovation team in the Free about a year ago. We had started scoping an XR program of work and talking about a partnership with you guys. But at that time, I think we were very much led by maybe sort of policy colleagues and thinking about, right, these are the main pillars of their plan, we should align to that. And actually, I think one of the things we do best in the innovation consultancy at the Free is really focus on the problem. And I really like how Dr. Robert Lewis was looking at the problem statements in his presentation at IVRA, because that's where it starts, really. What is the actual use case? What is the problem we're trying to solve, not what is some organisation telling us we should do? And so we tried to craft a program of work around that, but my initial exposure to XR and immersive technologies was just through that work, through scoping it, meeting with you and starting to partner with key suppliers. And now I'm a sucker, I'm hooked, I'm a convert. And the one thing I would say, though, is we focus heavily on the impact of it, and that many people in our program team are not as passionate maybe about the tech, but more about the impact, and that's what we really want to see. So, relative newbie. Well, that said, I think it's been really refreshing for me to meet so many creative people and people who've started in completely random roles and then have fallen into this world, this wonderful world that we are in. So my background was politics and then site-specific theatre before I was in health, and now I'm here, so there you go.
Very interdisciplinary bunch. Yeah.
Definitely.
And so what are some of these key areas that you've started to focus on? What were the big sort of problem areas that you've been seeing as a priority? Yeah,
so we've got 3 main work streams, so wellbeing, clinical application, and then training and education. No surprises there, really. But I suppose the wellbeing workstream is the one we've done the most delivery in so far, and I think it's the one that's the most urgent actually for the NHS, because many of you will know the NHS has got some significant workforce challenges that are only getting worse every day. We're losing clinicians and nurses hand over fist. People are just burning out, leaving the NHS completely. If any of you don't know a lot about the Royal Free and have access to BBC iPlayer, you can see a really great documentary called Hospital, which is a two-parter done during the COVID pandemic. We actually allowed a filming company into the hospital during the pandemic, which was, some people would think that was crazy, but it was really, really powerful. And they did a follow-up earlier this year, which showed the sort of the challenges we're facing in trying to clear the elective backlog and deal with the aftermath of COVID. And in that, there was an A&E consultant who I know, who has been in the NHS, for about 20 years. And at the end of the episode, spoiler alert, he leaves. And I didn't actually know until that point that I don't work with A&E that closely, didn't know that he'd left. And for someone to actually burn out that much and say it's time to go, it's so powerful in terms of showing what the need is in the NHS. So we've started doing a number of pilots across the 3 sites that we have to run staff wellbeing workshops using VR headsets, using some quite basic, nothing too high tech in terms of immersive experiences with staff, because a lot of them haven't actually used it before, but just enabling, like Tristan was saying earlier in her talk, to take a 4 to 6 minute break. Interestingly, some staff want to use it after their shift, not during their shift, because the reality of that is they want to, go home, try and switch off and then, get out. But the impact has been amazing. Some of the quotes that we've had from staff, just, reminds me of a beach at home. People haven't been able to travel as much recently. I had an ODP who was putting on the mask just before she was ready to go into, operating department practitioner, for those who don't know, who was ready to go into, to scrub in to do a procedure, and she put the mask on. She was feeling really, really stressed, and then used it for a few minutes, took it off, and was just in tears. She was like, I feel so much calmer. And then she went in to do the procedure. So I think that, if I wasn't a convert, I am now in terms of the impact there. And then for patient wellbeing, we're looking at doing VR for chemotherapy patients. So just giving them something slightly different in terms of the wellbeing offer. At the moment, they get hand massage maybe, or an iPad if they're lucky, kind of thing. So it's those kind of things. And then as well as that, we have a clinical work stream where we're looking at use cases for the application of more treatment-based experiences and training and education, which I'm really passionate about as a big believer in compassionate leadership within the NHS. I think coupled with the workforce challenge and the burnout that I talked about earlier, I think we have a responsibility to really support our staff in the NHS and create amazing leaders for the future. And we'll only do that if we deliver leadership training and education in a powerful and impactful way. And what better way to do that than through immersive technology? So those are some of the work streams that we've got going now.
And I'm assuming that lots of people here in the room also work in healthcare, bit as well, maybe not. But a show of hands, like who is working in XR Health in the room at the moment? And out of all of you, who's working in mental well-being? So like the majority of people, in fact. Anyone else doing things in clinical skills? A couple of people. And just broadly training, patient education. So, and is there a bit of an overlap then? Because it's such a nascent area in many ways. It seems like there's quite a lot of overlap in people that are developing these experiences that seem to be bridging lots of these different areas that is mental well-being and education. And I was curious of your process as well with these kind of companies that you're starting to work with. Do you see that they're looking at like very specific areas or kind of offering like a range of different experiences?
Yeah, it has tended to be quite specific up until now, but I think the beauty of having the scale or the breadth of what we're trying to do is actually we can see the use cases across the different work streams, whereas maybe even if a supplier or a partner hasn't worked with the NHS or has worked in health, actually it's a very different setup, and being able to look at that in a different way. So yeah, I definitely think they're all quite interdependent. And the clinical one I'm really excited about. We're working very closely with our Director of Research and Development, and our trust has a long and proud history of being first. It was set up by Dr. William Marsden, and it's one of the first hospitals to kind of treat patients during the cholera epidemic. So it likes to be first at these things. And so that, that goal to become a centre of excellence, whether that is an actual official label given to us by a regulatory body or just a reputation for being, a trust that delivers XR at scale. I'm kind of fine with either, but I think it's more about what impact we can give for our patients and staff.
Yeah. And it's been so like fascinating, like meeting your whole team as well, because I think in my experience in the past, it seems to have often been hospitals where it's like one person's like, yeah, I really get this, really want everyone to get involved. But actually at the Royal Free, like there's loads of you that all are so enthusiastic and again, really new to VR that have kind of, really taken this on and said like, we want to learn all of it. So could you tell us a bit about like who is actually, boots on the ground doing this work with you and how that is currently being structured?
Yeah, we're super lucky to have an amazing innovation and automation team, and this is within the innovation consultancy. So we have a number of the team who are working on this program. So 2 women called Aisha Ashfaq and Merich Oztap, who were here at IVRA actually earlier in the week. Some of you met them. Merich has been leading on our wellbeing work stream, and Aisha is actually sort of a technical lead and also a business development lead, as well as looking at the clinical work stream. She's also completing a master's in sort of immersive technologies and AI as well, so is really passionate about the tech itself as well as the impact. And then we have Jessica Huggins, David Norton, a couple of other innovation consultants leading on training and education. We're also doing 360 filming as well, which I know is it in, is it not? But for us, actually, it's a really, really positive way of actually maybe filming some of our hospitals that don't look like NHS hospitals or you would expect them to look. We have a HIMSS Level 7 hospital in Chase Farm Hospital, which is quite unusual in the NHS, and it looks brand new. It's a digital hospital. And so we're filming that to give patients reassurance about, they're coming in for a procedure or chemotherapy. It looks like an airport, it looks very clean and it's not something to be scared of, come in and have a look. So a lady called Erica Holder is leading on that. But we have a huge team of people who are leading on all sorts of different projects, so feel really privileged to work with all of them.
Very female heavy, which we
like.
Yeah,
women in tech, come
on.
Like
a bit more women in the room,
yeah,
please.
Absolutely.
Yeah.
Yeah, and we're a very diverse team as well in terms of the other protected characteristics too, which is really refreshing in the NHS.
Absolutely. So you're both bringing in experiences, but also starting to create stuff as well.
Now that's an interesting one.
Tell us more about that.
Yeah, it was quite nascent really, but there was a Unified Tech Fund which was open to applications last year, and we were able to win a small amount of funding for that, and we're working with a company called Sync VR at the moment to create a rehab app for physiotherapy. We do have a small development team for digital apps and platforms, which is another part of our business plan, or our sort of one of the pillars of our business, if you like. But that's for your standard digital apps and platforms, not for XR, clearly, because it's a completely different ballgame. So working with Sync VR has been really, really powerful, actually, to just understand how that's different and share learning with our development team as well. Whether we choose to do more of that, I'm not sure. But we're also partnering with XRHA and Nick Perez, your wonderful colleague who was at Torbay Trust, who was a one-man band actually really doing the stuff in his VR lab, but he's been supporting us with the 360 filming too. So we've got a lot of great people that we're working with.
Yeah, no, Nick was great. Is great. R.I.P.
He's very much alive.
He was very much alive. So we were originally going to have like a whole gang of us that were going to be here, but then life happened, and unfortunately they couldn't come along. But yeah, Nick Perez started the first VR lab within a hospital at Devon and Torbay back in 2015, and has been doing some amazing work over the last few years of bringing in experiences, creating them. But I think what I also really love about what they've done is really looked at the kind of full spectrum of the XR industry and what experiences are out there, and that there's things that are being particularly created for healthcare environments. Obviously, lots of healthcare companies in the room creating content internally, but also looking at what are these kind of experiences that are already out there that are amazing, kind of story-driven, artistic experiences that have benefits in themselves as well, and that we often really forget that actually they have value here as well. And when you ask people, especially doctors, like, what are you showing people the first time that you want to show a patient VR? And it's like, oh, it's Tilt Brush, it's Beat Saber, it's nature treks. And I love this world of, we're really blurring the lines into like, what is an intervention? And actually sometimes just like leveraging a bit of joy and giving a moment of escape and empowering people to be creative and playful is such a huge part of the human experience and patient well-being that is often really overlooked. And I think for me that this is an area that I'm really excited about, is the role of immersive technologies in social prescribing, or arts and prescription. I don't know if everyone in the room is familiar with social prescribing or heard of it before. Hands up, anyone that's not heard of it. Cool, welcome in. So social prescribing, I don't know, do you want to explain it or shall I do a little,
You go for
do
it.
a thing? So social prescribing or arts on prescription is kind of looking at that there are lots of patients that go to their doctor presenting with things like anxiety, depression, chronic pain, all these things that can't really be solved in a 10-minute appointment. And probably can't be solved with drugs or therapy either. It's like, how do we have a more holistic understanding of someone's life and what's going on for them? I know there's lots of really great initiatives happening in the US as well. In the UK, it's been quite pushed forward the last few years of how do we take a moment to look at this full patient experience. And so you can get prescribed to somebody called a link worker, where you can have a longer, more holistic discussion about what's going on in your life. You know, what's your financial situation like? Do you have financial stability? What are your relationships like? Do you exercise regularly? Like, do you have a sort of sense of purpose and meaning? Oh, you love singing. Did you know that there's like a singing class down the road? And that actually being like embedded in your community through engaging in like creative activities, like even things like going to the theatre can like drastically improve your health and well-being. And being able to just talk to people about these like bigger existential questions as well. So Devon and Torbay did a really great project a few years ago that I think they're continuing to do, where they were working with plus-size patients is the proper term apparently. So people that were actually housebound and not able to leave for various reasons, and were prescribing them artistic, kind of creative experiences where they would meet in these multiplayer worlds together. They would do breathing games. They worked with us on Deep, which is an experience I work on, a breath-controlled VR experience for helping people learn their anxiety. Or even just helping people like leave the house, like Google Maps VR, and going to the place that you used to go dancing when you were younger. And they had these amazing results, and they found that there were people that were like sleeping 2 to 3 hours a night that were now sleeping up to 8 hours. They had one patient that left the house after being housebound for like quite a few years. And that actually sometimes you don't need these like hardcore clinical interventions, but actually just having these moments that you can feel connected and creative and meet people where they are. And I think that sort of accessibility aspect is really important, and how we can make VR more available to people as well. So things like making it available through local libraries as well. I think for me, that's the thing I'm really excited about with working with healthcare, is how can we make VR more accessible to the wider public? You don't have to buy a headset or just have like private insurance to be able to access it, but this kind of preventative care is, I think, a really exciting area that can continue to grow.
I completely agree, and I think as a team we're quite focused on, not exacerbating existing digital poverty and health inequalities as well. So it's really important that we create opportunities for people to access tech where they may not be able to do that all the time, and might not be able to send a headset home with every patient, but if they're coming in for chemo or dialysis or something regularly, actually maybe they can experience it that way, and that could be their entry point. I also think you said something about that patient experience, and I really think that when suppliers or partners have got a product and they want to work with health, you don't have to think about it as being boxed into the health bracket. Every single person in this room is a patient of healthcare, right? And you may not all be a patient of the NHS. That's probably a good thing because we've got a lot of them. But actually, it's really important to think of yourself as a patient and your mum, your dad, your relatives, and think about the stories that stay with you from their experience of healthcare, and then think about the use case where immersive technologies could then meet that need. And that's what I'd encourage everybody to do. If you want to work with health, it's not always going to be easy working with the NHS. We have a lot of bureaucracy, but from the Royal Free's point of view, we're open to working with new partners and understanding new opportunities. And it might be small pilots on a smaller scale initially, but one thing you can get is impact, absolute impact, and health affects all of us. And what better impact than something like that? It's the power of the stories with the NHS and with all of healthcare. It's the stories that stay with you, whether you're a clinician, a patient, or whatever. So we're all about stories.
Totally.
Makes sense to work together.
Yeah, we had this lovely moment earlier where we were being interviewed and we were talking to someone, and they were saying that it was actually VR that helped them realise that they were trans, and that being able to actually embody different bodies and sort of explore their identity through these different ways really helped them understand who they are. And it was really just like quite a powerful moment. He was like, oh, I meant to be interviewing you. And we were like, no, tell us more.
Yeah.
And it's like moments like that it's like, yeah, this is why we do it. Yeah. And there's this need to obviously, you know, like validate these experiences, do these randomized controlled trials and have this kind of quantitative data backing it up. But also there's amazing stories where it is someone that's left the house for the first time, that's actually, you know, discovered something new about themselves. Like just being encouraged to be playful and creative when, you know, we're often told we can't do that as adults, I think are the really powerful moments within this.
Yeah, and while there is a need for that research as well, like one of the things we were saying at IFRA was there is an existing huge body of research on, you know, on the use of these technologies. So actually sometimes it takes, you know, an ambitious, proactive director of R&D to go, do you know what? No, we're going to try this as a service evaluation. It doesn't have to be a proper clinical research project. You know, it all has to meet the needs of ethics, proof and all that. But we're looking at doing a number of those things as well. I think it's really important.
Yeah. I think that's the challenge in so many different industries, isn't it? That we think we have to start with feasibility studies and prove the case, where it's like, well, let's just look elsewhere and see who's doing this well and at scale. And I think, yeah, again, VA fangirling so hard, just like, yeah, this is what, you know, XR health at scale can really look like. And yeah, across the, like, you know, globally, there's so many great examples of it happening that I think, you know, as Brits, we sometimes think we're doing stuff first, but we're not really.
No, we think we are, but yeah, trailblazing. But also it's seeing where it can slot into existing pathways, so complementing existing clinical pathways. It's not a panacea, you know, we know that. It's not going to solve all of the NHS's challenges, but there are a number of use cases where it can complement existing pathways, be that staff or patient.
Yeah, absolutely. So, what's next then? Like, where do you see things evolving and going? I know we're learning and doing this together, but I think what are you excited about for the future of Royal Free and how your XR program's going to develop?
I'm really excited about the sort of learning and development angle. We're not doing a lot around XR and sort of clinical skills training at the moment, so I'm really excited about that. I also really I think there's a use case around VR for leadership training, and again, that's the sort of an angle, you know, specific to the NHS. It has traditionally over the years been quite a command and control leadership environment for people, and it's trying to not be now. I can see Leanne from the Welsh NHS nodding in the audience. So I think there's a real need now because of all the challenges that I mentioned earlier. And yeah, absolutely doing more in the clinical space. To be honest, there's so many use cases, it's just trying to prioritise those at the moment, and finding the champions that everybody talked about, finding those clinical champions who, you know, even if they don't know about the tech now, they could get passionate about it. There's some great, you know, trusts elsewhere in London, place, you know, Imperial, for example, doing some stuff around VR in outpatient hysteroscopy, which is great. Anyone who's ever had it.
Hysteroscopy?
Oh, well, you know, women in the room might know what that is, but it's not a very comfortable procedure, let's just say that. I'd say it's like a very intensive smear test. There we go. Or, you know, that didn't expect to be saying the word smear test on stage. That's great, isn't it? Comms director will love that. Yeah, it's not very nice, but, you know, you don't get anything normally. You have to, if you can't deal with the procedure, you would normally go in for a GA. So that's, you know, saving patient experience, it's saving clinical time. It's just a better experience all round. So, you know, there are other trusts in the UK doing great things as well. Don't make it sound like we're the only ones, but we are trying to blaze a trail. So we want to be first in some things.
Yeah, absolutely.
Do you want to open up for Q&A?
We do. So lots of experts in the room that probably have some questions, might have some questions. Anybody?
So the NHS is going through like a lot of organisational change at the moment, kind of creating new acronyms and being under a lot of pressure to reduce costs as well. Can you see any areas where immersive technology has positive health economic benefits as well?
Yeah, it's an interesting one, isn't it? I mean, when is it not going through organisational change, though, right? It's every 10 years, historically. But yes, there's always a focus on reducing cost and improving productivity. So like, I guess, you know, the example I just gave from Imperial, that's a great one. In terms of, you know, the elective backlog in the NHS is enormous. That's a really high priority. So I think where we can use things to reduce procedures that would have to go into theatre otherwise, that's one. Tristan was talking about, you know, linked productivity as well in other organisations, whether you can actually accurately map wellbeing interventions to staff absence and sickness. I don't know, but it would be worth looking at it, certainly in the NHS, because that would be an opportunity. So those are two that I can think off the top of my head, but you're quite right, the health economics need to stack up. But the tech has been less expensive than people were expecting for us to implement, so I think that's a really good bonus, and that's why keeping the unit cost down is really important, I think.
Yeah. I think one example, so if you go to our report, xrhealthuk.org.
It's really good, it's
fully
interactive. It's online, read it.
Animated, illustrated, trying to make 80 pages of content engaging.
Yeah. Don't download the PDF.
Don't down the PDF, trying to save the planet there. Yeah. But yeah, we've got a whole section on health economics there, and I think we were quite overwhelmed. So we worked with the National Institute of Health Research, MindTech, they're called, that are based at the University of Nottingham on that particular area of research. And so we tried to draw out some really key case studies. And I think one of the most interesting ones was about pre-surgical anxiety, particularly around podiatry. So very specific, and that there's lots of reasons why you might cancel a surgery on the day, but one of them is very anxious patients. And so they were able to see if VR could just help reduce that anxiety beforehand, and looked at how much does it actually cost to reschedule that appointment, and how much does a headset cost. And actually, if you buy a headset and it works once throughout the whole year, you've already saved money. Yep. So I think that was quite an interesting example. But we tried to look at lots of different ones, because this is the challenge, right? There's so many different examples of how VR is being used in healthcare that it's just a massive thing to contend with. So being able to look at every single case study and how it could save time or money or energy. Again, another one was around education as well, so looking at giving medical students access to histopathology labs, blood labs, learning lots of technical terms. Anthropology degree did not pay off, but looking at how can you give people access to places as well that can be impossible to do otherwise. Anyway, go ahead.
I'm glad you brought up that study because I'm very fascinated, and there's a few of us in the mental wellness area here. So in that study that you were mentioning that you can download, are there use cases for mindfulness interventions or mental health, applications, use cases? I'm just wondering because in Iceland there's an implementation opportunity into healthcare, and we haven't actually approached that before, but I would like to see what's been done so that I can compare it to what could be possible and what future opportunities you see.
I think I can speak to my work with DEEP, for example, the breath-controlled VR experience. Then we worked really closely with the Games for Emotional Mental Health Lab at Radboud University, and we looked at lots of different environments where this breathing game could be used, and that not only could it reduce anxiety in the moment, but also it was empowering students with long-term skills in self-regulation. So it wasn't just that you can use it then, but actually how we are encouraging new forms of behaviour change. And one of the key areas that we applied it was in disruptive classroom behaviour for children with complex needs, and actually looking how it could impact other students' learning as well. But I see real value in places like waiting rooms, for example. That waiting rooms are a really stressful place to be in, and you're bored and you're anxious. And again, it's just these really simple use cases where it can be set up permanently, that you're not even necessarily bringing it to a range of different environments. But also thinking about how it can be delivered in a way that doesn't necessarily always need someone there on hand. So we ended up actually making a permanent installation that's a sort of semi-VR experience at the Science Museum in the Netherlands, and built it in a way that it's just you just need someone to switch it on. And I really think that's where we need to start moving to, is looking at how arcades and museums are starting to deliver immersive experiences, because the cost often associated with it is not actually just the headsets and the software, but actually that person that's delivering it.
Yeah, I should just say we're super lucky at the Trust by having an amazing charity, and so a couple of the projects I've talked about around wellbeing have been heavily supported by our charity, and the volunteers will be 90% of the time the people dealing with staff wellbeing sessions and running those. So you need some sort of supervision and facilitation, but that will be done by the charity, and we're super lucky to have that.
So Sarah and Sam, we're out of time. But I'll let you have the last word on this one. So who will be the next Prime Minister?
Me!
None of them. Yeah, Sam.
I reckon I'd do a right job.
Sam for Prime Minister.
No, thank you.
Yeah, it's been nice having a bit of a holiday from that.
As long as I won't say anything political. Thank you.
Thank you very much.